Some patients routinely request to have multiple procedures performed in one setting, and although it is very common for me to perform more than one cosmetic surgery in one setting, like a tummy tuck and a breast surgery, in this video I will discuss why it's not a good idea to perform a tummy tuck with fat transfer procedure to the body. There are both operative and post-operative implications in trying to perform these two procedures simultaneously. Let's talk about first the post-operative implication first. With a tummy tuck, there will be an incision in your lower abdomen, and it will be very difficult for you to lay on your chest. Now, for the Brazilian butt lift, you cannot sit for 10 to 14 days. We have discussed the reason for this in another video. Now, if you cannot be on your buttock or lay on your back, and you cannot lay on your chest because of a tummy tuck, it is very unreasonable that you will be standing all day during your recovery. This will make your recovery very, very challenging. Now, let's talk about the surgical implications. There are positioning factors involved when doing this procedure. Let's say that we perform the tummy tuck first. Typically at the end of the procedure, you bend your hip forward to some extent to close the abdomen. For the buttock portion of the procedure, we have to flip you over and you need to lay on your chest. Because you need to have your hip flexed, we need to keep you like that when you are laying on your chest. This will make the removal of the fat harder, and also the injection of the fat, because the anatomical landmark becomes distorted when you're not laying completely flat on the surgical bed. But now let's say that on the other hand, we do the buttock procedure first. We first perform liposuction on your abdomen, so you're gonna be lying on your back. We'll flip you over to do liposuction on your lower back, upper back, and for the injection of the fat. Now we have to flip you over again on your back to do the tummy tuck procedure. You can see that this is not very practical. What I recommend is for you to have your buttock surgery first to harvest as much fat as possible. And this fat obviously will be used for the buttock augmentation and the buttock and your buttock sculpting. 6 months later, you come back and we'll perform a tummy tuck. Having both procedures, although theoretically possible, from a recovery and a surgical standpoint, is not very practical.